Hello, my name is Vanessa Banda, and I'll be talking about cytomegalovirus. The acronym is HCMV or CMV. Have I seen it today? I'll also be talking about pathogens and their characteristics. When most people talk about pathogens, usually people think about flesh-eating diseases or something that's really deadly. I personally think about zombie movies, World War Z with Brad Pitt, there's no return. Like once you get the pathogen, you're dead basically. The definition of a pathogen is a bacterium, virus, or other microorganisms that can cause diseases. The characteristics of a pathogen, the optimal growth of temperature is about 35 Celsius to 37 Celsius, which is converted to 95 to 98 Fahrenheit. They produce toxins and some possess enzymes that are able to clot blood, and DNA aces, which is they're capable to denature DNA, so basically kill the DNA. They have a cellular mechanism that renders them ability to protect themselves from antibodies, which makes them really deadly. Diseases that are produced by pathogens are like Lyme disease, Ebola, which was in the news a couple recently, anthrax, and strep throat. Now I'm going to talk about the pathogen Cytomegalovirus, or CMV. The mode of their transmission is through body fluids, such as blood, tears, saliva, urine, semen, and breast milk. Women who are carrying kids and have CMV, they're likely to pass down that trait to them, or when they feed a child with their breast milk, they can also pass it down. CMV can literally affect anybody. It doesn't matter what age or how you really treat yourself. If you get it, you're stuck with it forever. There's really no treatment for it. It's just mostly depends on how your immune system is. If your immune system is really healthy, then nothing's gonna really happen to you. You're just gonna carry it for a long time, forever, basically. And if you have a weak immune system, then that's when things start getting bad. People who have weak immune system, it can affect their eyes, liver, lungs, esophagus, stomach, and intestines, which causes sore throats, fever, fatigue, and swollen glands. Occasionally, it can cause mononucleosis or hepatitis, but that is the worst case scenario. But mostly just keep your immune system healthy and you'll be fine. It doesn't, people who have it don't realize they have it, so people do get up checkups for that, because it doesn't show any symptoms if you're healthy. For babies, it's much more dangerous for them. It can cause birth defects. It messes with their brain, spleen, liver, lungs, and gut development. The most common thing that can happen if they have CMV is that they lose hearing. But if they get better, hearing does come back, but that's it's kind of difficult during that stages when they're young, since they can't really get a lot of medicine. If you want to find out that you have it, you can go to the doctor and get a blood test, and that's how they determine if you have it or not. For infants, it's much more different. Blood tests are not recommended for them. Saliva and urine tests would be fine to determine if they have it or not. There isn't really a long-term and short-term effect. Once you have it, you have it forever. It mostly determines on your immune system how good it is. If you start showing those signs of sore throat, fever, most people would dismiss that as a common cold, but it doesn't hurt to get to the doctor and check up if you might have CMV. If you do have CMV, the doctor will recommend you some type of medicine to calm down those symptoms, or they can give you antiviral medicine to calm it down. Also, you can look up things to boost up your immune system, get healthier, and those things can really help not activate it that much. A good way to prevent getting CMV is just keeping up a good hygiene, washing your hands for a good amount. Just don't rinse your hands with actual soap, especially if you're around little kids. Avoid contact with saliva and tears when you're around kids. Sometimes kids are really messy and just like put their hands in their mouth and like put it on your face. Like make sure like to like be aware of that. Avoid sharing foods and drinks out of the same container. People usually do this with big groups and don't realize how much risk they're putting themselves in and putting other people at risk. Be careful with disposable items such as diapers, tissues, and other items that have been contaminated with body fluids. Be careful not to touch that with your hands and then touch your face right after. If you do touch them, like make sure to wash your hands right after you dispose of them. Clean toys and counter tops, especially like places that have like are known to be kids around. But if you go to like just a place, make sure like carry like wipes or something. Also like practice safe sex. Like you just never know what people can have in their history. So that is all for CMV. It's a really known pathogen around people. Like a lot of people have it. I never knew of it until I did this project. So I'm kind of curious of like if I have it or like if someone else that I know has it. Like once you have it, it's forever. So I don't really see the symptoms, but like my immune system is good. So people just never know if they have it or not. Thank you for watching. Bye.